Can she hear me? Jane, can you hear me? Nope, I can't hear you though.
I
Oh,
hear you.
good. We have permission to record the meeting with you?
Sure.
Good. Okay. We're just still setting up, everybody.
I wasn't sure if you want me to shut off my screen.
No, no, no.
Okay.
Should we ask her to put libraries under her name?
Change the name.
Jane, yeah, change the, yeah, do you want to just put Director of Libraries or?
Yeah.
In Hillage, if you want, you can put Chairman Board of Health.
Yeah, I'm okay, Bruce, with that.
Okay. You don't show Mallory though. No. I've got to look out for Charlie, so I'm just seeing if he's pulling in the parking lot. Sometimes he just, because the doors are locked, I have to listen for the car horn.
Like a first date.
So I guess I would take him. Can everybody hear me?
Yes, sir.
Yes.
Okay.
I can hear you, Bruce.
Okay. I think Charlie, board member, just came by and left because the back door, I must have missed him. He left his packet there, so I know he was here. So he didn't stay, so I could let him in. So I don't know if that's like maybe an excused absence, but we do have a quorum here, Mr. Chairman.
Yeah, you hear anything about Mary or not?
No, but I did leave a message at the house, her house on Friday that we did have a meeting.
Okay, fair enough. Okay, so why don't we get started?
Okay.
Ron, just let me know.
We do have one person here, Jim Cullen, that's on for other public comment.
Great.
Yeah, thank you, Bruce. Jim Cullen, I live in Yarmouthport. I did listen to Bruce's message Friday night, which said, and I see item 2 on the agenda.
Sir,
Oh, sorry.
sorry, we're gonna need to start the meeting first.
Okay, gotcha.
Okay, but it's always nice to have someone calling in or showing up at meetings. So I
Sure.
just need to know when we're live and ready to go.
No worries.
Okay. Meredith, are we live?
Yes. Yes, you just need to read the regular
We're
information.
live, I just need to know. Fine,
Yes,
okay.
Okay.
Good evening. Yes, I'm Hillary Bosky, Chair of the Board of Health, and this is the November 23rd, 2020 meeting of the Yarmouth Board of Health. First thing we need to do is just state that we're following Governor Baker's orders, and this meeting is being held as a remote participation meeting. So why don't we start off with attendance? Charlie, are you there? Apparently
He was
not.
not, he tried to get in, but the back door was locked, Mr. Chairman, was able to get in, did leave a note that he was here. So unfortunately, we're not able to connect at the same time.
Okay, Mary.
Present.
Okay, that's great. Deborah?
Here.
Eric?
Present.
Okay, and Bruce, are you here still?
Yes, I am, Mr. Chairman.
This is all good? This is all good. Okay, so it's kickoff time. Why don't we go right to the public comment? And I believe someone is here, so.
Yes.
You're on, sir.
I'm good to go. Thanks. My name is Jim Cullen. I live in Yarmouthport, and I listened to Bruce's report Friday night. And if I recall correctly, he said that there was all ages, all parts of town in terms of our uptick. And I did go on the Barnstable County website over the weekend and saw that I believe we were about 3.5% positivity rate the last couple of weeks, if I read that correctly. And I know I'm going to learn a lot more in item 2, so I'm kind of commenting a little bit from ignorance, but looking forward to seeing more details. But my commentary would be that I think back to March, when the select board was not exactly as supportive as I, as one individual, would have liked them to have been. And I commend the Board of Health for doing what you did. And here we are now, some 7-8 months later, about to hit Thanksgiving and Christmas, and we know what's going on. And I would be very supportive of whatever actions versus observations might be recommended by the Board of Health to the Board of Select people, if that's needed beyond your authority, to take some further actions depending on what the data shows, such as reducing the hours of restaurants, such as putting every Friday, at least for the next 4 weeks, some more specific data out, because our little bubble like every place else, is now getting a little bit out of control, it appears. And I just want to say I am supportive because the fatigue is here, but the vaccine is not. And we need to somehow constrain this in any way possible, especially at a difficult time like the holidays when everybody wants to get together. So I will stop there. Hopefully my comments made a little bit of sense. I tried to go quickly so that I didn't hold you all up, but wanted to share my thoughts of concern with you, my thoughts of support for you, and don't take any guff from the select board. Do what you have to do.
Thank you.
Thank you for coming in, and don't feel rushed if there's anything else you want to say. We're volunteers in the town, and we're open to hear from the residents. Anything else?
Well, no, again, I mean, we're not alone. I know that. And I know where the town of Barnstable stands. I've tried to do a little bit of homework, not to sound overly reactionary, but we're at a difficult time of year. Nobody wants to hurt businesses, but something is going south. And a million, however many millions were in Miami yesterday catching airplanes, they said. This fatigue factor, I just don't know why people are not, I don't go out much, but I do see, unless they're getting out of a car, walking into the Stop and Shop, or I'm sitting in the parking lot waiting for my wife to go in and get the things she has to get. Men more than women don't put their masks on, it seems, until they get near the door. So I don't know what you can do. I really don't. But it seems to be getting really out of hand, almost to the degree that it was, if greater degree than it was back in March. And that's very, very troubling. So I, for one, support you in whatever actions you feel are necessary. And if something has to be approved by the select board and you need a townsperson to support what you're doing, let me know. Okay. Thank you. And I'll mute here.
Thank you.
Thank you, Jim.
The effort you've made to come forward and share your thoughts. Hopefully you'll stay on for the length of the meeting. A lot of this falls upon the Board of Health, some of the decisions that need to be made in town. Meredith, Bruce, is anyone else from the public?
No one else is from the public on the meeting or wish to speak. We can go in and I can post the agenda so you can get a look at what's coming up, then we can roll into the first update.
That's great.
Okay. We'll post the agenda. Okay, here we go. So it's just for the people at home, they can see the agenda. We're right here. We just had the public comment. We'll go into the update on the coronavirus. We'll move through there with statistics and graphs. Then we'll mention what the state has for an update. And then we'll go into updates of complaints that we're still receiving, remind people about upcoming Thanksgiving. And then at the end, we'll talk about sticker shop campaign that we worked with the liquor stores in town. So what I do have, Mr. Chairman, is under new business, just to let you know ahead of time that we do have with us tonight at the meeting in the audience, Jane Kane, the library director, that as the board remember, reviewed her opening reentry plan for all the libraries. With the new uptick in cases, Jane wanted to talk to us about maybe making some adjustments to the library. So what my plan was, Mr. Chairman, is after we give the coronavirus update, but before we get to the flu clinic information, Jane could speak what she's hoping to put forward for consideration.
We can do such a radical thing as dropping down on the agenda like that. Yes, I think we can handle this.
Okay, thank you very much.
So Bruce, a lot of it falls upon you looking at the agenda in the sense of reporting
Yeah.
information. So take it away. Thank you.
Yeah, so we just thought we'd add a new slide right here just to catch everybody's attention of what we're working with and our concerns with the coronavirus. So that will bring us right into, this is interesting, board members. This is what went out in your packet, and this is what we had on Friday. As you can see up in the top right-hand corner, November 20th, what we had for coronavirus cases in town. On Friday, which was the most updated we had an overall of 229 positive, 49 active, 177 recovered, and 3 deaths. That's been increasing daily, which the board follows, so we know that, but this is just to show the public. These were the numbers I believe I used pretty close on the robocall educational information code red that I sent out to the residents on Friday. What we did is we broke it down by village, just to want to show that it was community spread, that it's just not in one particular village within Yarmouth. We can see it's pretty much community spread. So I think that's important. So that was based on Friday. If we go to the next slide, based on today, we can see that number from 49 active cases as of this afternoon now has jumped up from 49 to 64. So you can just see how quick things have changed on cases coming up on late Friday night, Saturday and Sunday, and even until today. So that boosts up our overall numbers to 252. And as we broke it back down again, and this is what Phil Murnau of the Health Department stats that he monitors every day, broke this down late this afternoon, and we can still see it's in community spread throughout the community. And I think that's important for the public. It's not a cluster that we have at, let's say, a nursing home or a business location. It's throughout the community. Any questions on that, board members or Mr. Chairman?
No, it's just a good point that there was not a super spreader event here. In town.
Correct,
And
correct.
I think that's important that the public understand that.
Correct, and we're still waiting for, any possible surge after Halloween. We're coming up on that 2-week time. But, most of those events were outside, unless some people had some Halloween parties, but, we're not getting what we believe is a surge on that day. The next graph will show the age breakdown. And again, this was based on last Friday with our number of 229. And we can see that it's really spread pretty evenly now between age 20 through 69. So it's pretty well distributed that way. And then we can look down at the bottom right there, pretty close. Females are a little bit more than the males. Even though we noticed that the males weren't, Jim noticed the males weren't wearing the mask as much, but somehow or another. But that was on Friday, so we redid it for today numbers.
Excuse me,
And-
Bruce? Okay, go ahead.
And we can see the new number that's gone up to 252. We can see an increase in that age group of 30 through 39 has come up even more. So again, it's probably shifted. If we had looked at this in the earliest stages of the pandemic back in maybe April, May, I think we'd have saw a little bit more of the positives in the higher range. But I think we've seen it as part of the community spread throughout the ranges. And we can also see it as under age 20 has started to pick up. Obviously, we have some at times with children in schools that we've gone down to age 5 with a positive. So I think this is again another important graph to look at that shows besides community spread, it's across the age range.
What I was about to say is that we had a lot of concern about the school system. And it's interesting, with the age there under 20, it's 17. And we were certainly concerned that that would be, the group would be spiking by now. So it's just, as a comment, the school system here so far has been doing a great job,
Yes.
really great job, considering you have kids sitting next to each other all day long when they're in the building.
You know, their concern as the age starts to, in that 30 to 39 group, that's probably the age group of parents that have school-age children. So, and we know a lot of the positive spread is within the household. They're not picking up in a particular cluster, as I had mentioned, but they are picking it up within households. So whether that's what we're trying to discourage is gatherings between households or dinner parties or sleepovers, play dates,
Thanksgiving dinners.
eating dinners. So I think it's so important that it's at all age groups and they all need to take precautions on staying away from gatherings and dinners. Play groups at the playground, you know, meeting the kids are on the playground. Yes, the kids might have masks on, but the parents are sitting on the side of the playground without mask and just talking. So it's important, I think, all age groups. You can even see the 20 through 29 is important now. So I think that's important to stress, Mr. Chairman.
It's been easier when there are positives in the school. The contact tracing has been a lot easier to track through the school system than it has the general public, which has been very difficult.
Correct. Okay, the next, I think you're the next chart. The next chart, we have our Zoom master puts together, Meredith, that we see at each of our meetings. That's absolutely terrific. That shows very visual the active cases that we had at the beginning in March, April, where it leveled off during the summer to, you know, a couple weeks that we even went without any cases. And now we see that surge that we're getting that just started November 11th, so to where we are today. This one has been updated to show us 64 active cases. Mr. Chairman.
Thank you.
So it's very, very graphic that you can see that we are in the, I would say, the start of a surge. I don't want to say we've leveled off, as you can see in the earlier part of the graph where, you know, you had the surge and a spike up and it stayed up. The surge that we're in is still going up. And I believe from what we're seeing in other towns, Barnstable, who has just moved to the red, and they have a big surge in positive cases, to other towns in Massachusetts and other states within United States are seeing a surge that's heading this way. I would think our surge would probably continue before it levels off. And especially with the concern of Thanksgiving coming and a lot of people traveling.
Okay, thank you.
Okay, we'll go to the next chart. This one is a chart provided by and followed by the chairman, and I'll let you explain this one, Mr. Chairman.
Yeah, just a reminder again, those blue vertical lines are daily counts. And the orange one I created there, the horizontal line, is a 7-day average. Obviously you can see what's taking place. I think the average, we had 1 week in the beginning of May, I think it was the week of maybe the first week or second week early on, where we had an average daily count of 4. And right now, on our average, we're nearing 7. So it's significantly greater. And I agree with Director Murphy, with the holiday coming up, and certainly we can talk a little bit more about Thanksgiving, but we could expect 2 weeks or so after people getting together on the holiday. I think it's going to climb rapidly. So anybody have any questions about this graph? We've all seen it before. I'm just, I update it every day. That's what I do.
Well, appreciate you maintaining that graph and working closely with Meredith as she prepares her graph and stats daily with us. So I think it's a good, helpful visual update for the public when they're viewing it. The next chart is what we pull off of from the Mass Department of Public Health state dashboard that comes out every Thursday. So when we looked at this last Thursday, their counts are a little bit less than ours. They had 46 out of 204 cases. They're a little bit behind us on cases because at the beginning, we had a few probable cases, positives that we put in. So that's why we're off a little bit on this. But you can just see when they pulled their data from Wednesday, how much has changed just in the last 4 or 5 days. I think what's important on this one is the total number of tests that we've had in town right here of 12,429. So the last 2 weeks, there's been almost 1,500 Yarmouth residents tested. So we're testing about 750 residents per week. Some of that is healthcare workers that are getting tested every week in our facilities, along with people just getting tested that would have a concern. And I'm probably sure that will be going up this week with people getting tested because they're traveling out of state, possibly now that, or coming in state from Maine, New Hampshire, or so forth, that need to get a test. So I'm expecting that number to rise. So I think that's important, the number of positive tests and the percent positivity.
Is this all forms of test, like a rapid test, or, just total number of tests across?
No, this is, go ahead, Mr. Chairman.
Yeah, Eric, I was just gonna make that point. When we talk about COVID positive cases, there are a lot more positives out there than we're, recognizing or putting on our graphs and so on. For instance, there are the antigen tests. There are a number of them out there. They're being done. The results come back a little faster. Our statistics are not reflecting that. We're not including it at this point. And so obviously there are people out there who are positive, aren't even getting tested. So these graphs are fine, but it's not really showing you the number of people out there who are positive and are transmitting the infection. So at some point, the antigen numbers are going to go way up. We're going to do more, and it's convenient, it's quick, and there should be more, and we're going to have to figure out how to put that into our statistics. I don't know if that answers your question or not.
And that's a great question, Eric, and that's a very good answer, Mr. Chairman. I think that's the one that we have discussed quite a bit because all these probable positive cases come out. It's the quick test, and then they tell you, well, go back and get the PCR test to confirm it. And people aren't going back to get the second test because they're saying, well, if I'm already positive, I don't need to go back to confirm it. And I'm not going to pay again to find out that I need to go back. So that's the challenge.
We might want to comment that the 5% is kind of the cutoff for positivity rate in terms of considering it higher than it should be. Although we're seeing 20-40% in other parts of the country, which is pretty horrendous.
Correct. And I think that's the concern because that part of the country that wave seems to be heading this way with travel and so forth.
We've reached the point where we're accepting low levels, which is
Right.
That says a lot to itself. If it's over 1%, it means it's spreading.
Right. Okay, our next chart that I put in comes from the Department of Public Health. I know you board members have it in your packet. It might be a little bit hard to see at home, but this is from the contact tracing where they're finding majority of the confirmed cases, which is in the household setting. For the week of that they released on Thursday, the 19th. So that's the biggest area right there. And I just wanted to put that in from the area that they're keeping track of for at least right now. And this changes obviously every week. You know, childcare is another thing, area to be considered with.
However, household is by far and above the largest number with 6,334 clusters. And
Correct.
it'd be pretty hard for any of them to beat that without a large super spreader event or something else happening.
That is correct. And I think that's our concern with gatherings, dinner parties, sleepovers, and so forth, that a lot of it is being generated through households. We do have several households in town that have several COVID cases, and it's gone through the household, whether it's the children and parents and so forth. So I thought this was a interested new slide that I've wanted to include for the board. Okay. So with that, I think what we went next to, Mr. Chairman, if you want, I have the statistics from the library.
Why don't you explain that for us, Sean?
Pardon?
Why don't you explain that?
Okay. We can look at.
This is just what the different libraries are doing.
Yes, yes.
Hours they're open and
Yes.
so on.
Is Jane Kane, can we see her? Can you move her along? I go down right here. There she is. So we have Jane Kane, Library Director, and as the board remembers, the board reviewed and approved the library reopening plan. And that plan entailed limiting the number of people coming into the libraries, tracking people when they come in, having them sign in, so forth. The libraries had started out as book pickup, and they did that for a period of time. And then after the cases had come down, it was considered that, yes, they could start having limited number of people come in instead of just doing curbside. However, now with the increases of cases, concern with the library staff in the small, tight quarters, we want to hear from Jane on their concern within the library. Currently, it's limited. The computers are still not used within the library. The children's book time is limited also by appointment only. We were able to do some this fall that was outside. So Jane just wanted to tell us what's happening with our Katuitt libraries. And here's a quick look that she can go over what's happening Cape-wide also. So with that, Jane, if you can, with that nice little lead in, you can just give us a nice an update. Thank you.
Thanks, Bruce. And thanks for inviting me to the meeting. It's nice to see everyone. I appreciate your time. I sent a note to Bruce and to Sarah, our human resources person, and to Dan, the town administrator, to ask for some advice, because I'm hearing concerns from my staff that they're worried about the Thanksgiving holiday, the increase in numbers in general in our community, and then anticipating a Christmas holiday or Hanukkah celebration, which would be the same kind of concern about travel restrictions and things like that. So they wanted your opinion on what we should do. The other factors to consider are that we're pretty busy. So folks are really enjoying that the library is open. It's 5 hours a day in South Yarmouth and in West Yarmouth. We average about well, we can get up to 70 people at one time, not at one time, 70 people during one shift at South and up to about 35 or 40 at the West Yarmouth Library during the course of that 5-hour shift. So we're doing fine in terms of the occupancy restrictions and things like that. But what we're finding is that there's non-compliance with the mask wearing. So folks will they'll have their mask and they may need an adjustment so that we remind them to cover both their nose and their mouth, and they'll do that. And then they'll come in and they'll do the contact tracing information. They'll step away from the front desk at both locations and promptly take off their mask.
Oh, no.
So we're having concerns that we're having to police that behavior, and certainly we're getting a little bit of pushback. So that's concerning to me that my staff has to do that monitoring, and I can appreciate that must wear on them. But the other thing, as I said, is that we're coming up against the holidays. We'd like some advice in terms of whether or not we should scale back our services and go back to curbside, maybe for the winter, or maybe for November and December and until mid-January. I don't know. That's why I came here, to get your opinions and your smart advice.
Thank you for coming in. So
I'm at home. It's awesome.
board members, what are you thinking about?
Jane, is there signing? I haven't been in the library. I did a curbside pickup. Is there signing about mask wearing when folks enter?
Yes. We have a couple of the different signs that the state had provided. We have the no masks, no shirt, no shoes, no service sign, which I love. We have the visual of the mask, you know, that simple sign, that's right at the front door, right center, like you see it before you open the door.
So people can't like feign, oh, I didn't know I had to keep it on the whole time or something. They're
Correct.
signing.
Correct. Yeah.
Okay.
I mean, I can tell you at the state meetings, you know, conference calls I'm on twice a week, you just hear it over and over again. Essentially, people don't want to be told what to do. And enforcement is very difficult. It can be dangerous. And it puts your staff at risk for themselves. People get angry, don't want to be told. So it's very difficult. So I understand what you're saying.
I think that if people cannot comply, then the opportunity to come into the library should be taken away. And I'm sorry about that, because there are certainly people I think that do comply. And it's punishing everybody, because there are some who are just not going to be considerate and respectful of others and wear their masks all the while that they're in the library.
That went back, you know, in the summer and the spring, when we were shutting down the boardwalk down at Grays Beach, because
Yep.
we're walking right next to each other. And it's a shame for the people who were not putting on the masks and ruined it for everyone else, you know. I can tell you some of the state conference calls, when it comes down to it, you need to call the police. If it's something that's dangerous and someone's really acting out, it's a sad statement, but ultimately that's, you know, your call.
But that's asking the library staff to put themselves in a policing position, which is, as you mentioned, Hillard, it's dangerous these days. Plus, very unpleasant, very awkward. It's not the kind of thing that librarians or any other workers, even the retail stores and the supermarket workers are trained or expected to handle in normal times.
We haven't had a lot of problems, but I mean, if it's one or two a day, to me, that's a lot in terms of stress. For the
It's
whole
too
group.
many.
Well, yeah, because other folks are witnessing it as well. So
Right.
You just need one person who's positive breathing on your staff or anyone else who's using the library.
I know.
Maybe Bruce could do a library special update and say that because there are people who are not willing to comply, that privilege may be taken away. or that opportunity to actually come into the library and enjoy being in there.
The library's been steadily being used right now, Jane, at all? I know when you've gone from curbside, it really picked up business coming in, even though they had to wait while people are coming and going. But I know people have enjoyed going to the library. So is it a steady amount?
It's indeed steady, and it has been steady since September 21st when we began to reopen to the public. I actually think it's gaining momentum at the West Yarmouth location so that the numbers are growing at West. And as I said, it's 50 to 70 people. The highest number in one 5-hour shift at the South Yarmouth Library was 96 people.
Wow.
So that's a lot. I mean, and we have a 15-minute time frame that we ask them to respect, you know, visitors to the library, and everybody's been pretty good with that. We've only had a couple instances with folks who are trying to do things on their phone and print and do all that, that causes a little bit more time consumption. I mean, most what we're observing is that people are being compliant. The staff is concerned about the holidays coming up, about the cold weather, and what to do if the numbers keep increasing in Yarmouth.
Sure, people are not going to be excited about waiting outside when it's, 29 degrees out there.
Right, or snowing.
People the limited occupancy right now, are you able to control that? So I know you have a person at the front taking COVID information down. Do they also limit the number of people coming in? Is that during the day that's becoming more and more limiting, that people have to wait outside?
We're doing pretty well in terms of monitoring the number of people in the buildings, but I would say from Monday through Saturday, it's twice a week or 3 times a week where we have to just halt people at the door and make them wait outside until they can come in. And then we wait until other folks leave, and then we let more people in. Does that answer your question?
Yes, it does. And I just hope the people that, one, have patients waiting outside, but then also the people that are inside, know the book that they're looking for. So they're not, I know you have a 15-minute time frame that, hopefully they don't push that 15 minutes all of them. They know what the book they're coming in for, or what's recommended. They've done some research.
It depends how long it takes somebody to find a good movie for Friday night, I mean, there's a lot of activity in the non-print area of audiobooks and movies and things like that. But people are being pretty good about that time limit.
Good. And how's the children's time coming? I know that they had appointments. That seemed good. It went outside. That was terrific. You want to just say how that seems to be working?
I would love to. So in October, they had twice each week outdoor story time at the West Yarmouth Library, because it's a nice big lawn and there's plenty of space. And there was only one day that was rained out. So that was pretty good for the month of October. They may have extended it like one more day. But anyway, they love that. Our staff has been putting together kits for the kids to do crafts that are usually accompany a book kind of activity. So that's a learning experience for all children from toddler age up until 5th or 6th grade, for kids who are interested in that. And they came up with another idea after doing a lot of summer programming and fall programming that was virtual. The staff came up with the idea of putting together book bundles for families who will call in the morning and say, I'll come pick it up at 2:00. Can you pull, all the books by Mo Willems or all the storybooks you can on volcanoes or whatever, they'll have different requests, and our staff is fulfilling the book bundles so that folks can pick up a bag of books at the end of the day. And that's been very popular. We have a lot of those. So that's their own version of curbside delivery. Without having to make a formal request, they'll have our librarians pick things out for their kids. It's lovely.
So right now your staff, even though they have the occasional people who are not compliant, they're fairly comfortable, but their main concern is that there will be more people out in the community who are infected and more opportunities for spread as we get into and past the holidays.
That is the concern. In fact, Ms. Craig, I have a couple employees who have let us know that they would rather not be at work right now. And they're part-time folks who we call for substitute coverage. And they say,
Right.
put me on hold for a few weeks because I don't want to come in.
Mhm.
So that makes me worried. I don't want people to
Right.
be kind of stressed.
How's the curbside pickup going? Do you still have people just using curbside?
We do. Thank you for asking, Bruce. There are families who just prefer the curbside. In fact, we figured out just like late last week that some folks didn't realize we were still doing curbside. So they were coming in and then they saw the curbside bundles by the door, under the awning. And they said, oh, we can still do that. So folks, even though we're open to the public, would just as soon come and pick up their things and not come in.
One thing
And they're
that's,
the ones that would probably be very compliant with masks too.
Yeah, I think you're right about that.
one of the things that has changed and since we, I guess, worked together about changing the format of the library was that transmission certainly seems to be via the air essentially, and not on surfaces.
Right.
That's how it's being transmitted, and we weren't aware of that.
Right.
4 months ago, the extent of it, and so it's going to be easier to do the curbside, I think, in sense of the precautions you had to take. I don't think they're going to be as essential, or maybe the length of time that things are left alone in a box, the books and whatever, that kind of thing.
Mhm.
I think one question we need to answer is there a point when we need to make a change? In other words, what is that point? Is it when someone gets sick? When your staff refuses to come in? When your staff finds themselves having to enforce things that they should not be doing? Or are we here now where we need to make an adjustment? So it's a question for everyone.
I think we need to discuss an adjustment now. I'd much rather not wait until someone becomes sick or a group of people are just too uncomfortable to come in.
Would it be worth it to further reduce the hours through the winter or the days that it's open?
That's a possibility. It would reduce our exposure.
That's what I was thinking. And you would need less staff if you were open fewer hours or lesser days.
Well, what did you have in mind yourself in terms of paring down your services so that people would feel more comfortable?
I don't know the answer to that, and I was hoping you would tell me. I was under the impression in the city of Boston, didn't they determine that 3% was the magic number for contamination, or am I recalling that incorrectly? And when I saw that our rate is over 3%, I thought that might be the threshold, but I don't know.
Just as a side point, Jane, is the libraries getting cleaned nightly on a regular night basis and during the day, or touch point cleaning at all?
To my knowledge, Bruce, they're following the schedule that was set up at the beginning of the fiscal year, and that is 3 cleanings per week at South, and we're open 6 days a week, and 2 cleanings per week at West. So it's not every day.
And any of the touch points, doorknobs, front desk, so forth, that is left up to staff?
It is. When it was like March and April, I remember coming into the library in the morning and I knew that they had disinfected that day because you can smell the different chemical or whatever that it is for the disinfection. Now I'm gonna, I just have to go on faith that it's getting done as best that vendor can provide those services. But no, we're wiping down our workstations, and we're conscientious of, folks are sharing telephones because they do at the library. The staff does. So we wipe things down.
The question is, there been more restrictions earlier when the numbers weren't as bad. So things are much worse now by far.
Good point, Hillard. That's logical reasoning, I think.
So why aren't we returning to the previous status of pickup?
Only.
Correct, yeah.
We'd be fine with that, I think.
I would be too.
You know that we have Wi-Fi that folks can use, and if you're near the building, you will have internet connection, and people take advantage of that, you know. So I feel like I feel bad that we can't offer them all of our full computer services, but we can offer them quite a bit, even if we're not open to the public all the time.
Well, Mr. Chairman, one thing for the board to consider would be to kind of go forward with the library director's request of a pause in library hours or so forth, and go more towards curbside pickup, and make that a recommendation to the town administrator, Board of Selectmen, for them to
Fine
take.
with that.
And I think that was your request that you put in, Jane, to the town administrator for your request, and you're looking for support going that way from the Board of Health.
Yeah, stepping back to I think it's phase 3, step 1 versus phase 3, step 2, where we are now.
Director Murphy.
Hmm.
Who in town has the authority to put that into effect?
Well, to me, it would be, my understanding would be the town administrator and selectmen that would be directing staff the hours that they need to work and what hours, whether they're working at home or at a direct office site, and whether that's at the libraries or town hall or outside department. It would only be the selectmen that could dictate the work hours. I think it's a little different than when the board acted in the spring on asking outdoor areas, a beach or a boardwalk or a playground that should be closed, because that didn't affect any working staff. But to have staff be directed by the Board of Health, I think that's something that would first go through the selectmen.
So it would be a recommendation from us. Is that correct?
I believe so at this time, yes.
Jane, the hours would change for the employees.
They actually stay the same, Hillard. What would happen is that my on-call team would have fewer hours. They would be on call fewer hours, but the full-time folks stay busy. I have 1.5 staff members right now who continue to work remotely due to a variety of situations, personal.
Sure.
So the hours for the staff stays the same. If you're scheduled for 30 hours a week, you work 30 hours a week. If you're scheduled for 37, you work 37.
I'm glad to hear that.
There's plenty to do, believe me.
Bruce, if we're making what you're calling a recommendation, is that something that has to be voted on or not?
I would think a full vote by the board would be welcome for support of Jane as she goes forward to the selectmen.
Okay. Any other discussion? Someone can make a motion and we can decide how to move forward on this.
And I'm not sure we have to the board has to specify whether it's hours or curbside. I think just a motion of support for the library director to consider a discussion with the selectmen for a pause in service.
Thank you, Bruce. That helps.
Jane, you and I and Bruce can have a discussion about that if you're going to be putting something on paper and sending it to to the selectmen. All right, we can look at that a little bit.
Certainly, and this will also give me a chance to bounce it off of my department heads and get their feedback. Because I might shock them if I told them we were going back to curbside, and they might want to stay open 2 days a week. I'm not sure. So I want to have that conversation.
Right. You also work with the library board also, Jane?
Yes,
So I'm sure they would want some input into this.
yes,
Yeah.
indeed.
Have they just, is this on their upcoming agenda at all?
It will be. We just met on the 19th. So the next meeting, I believe, is mid-December.
Oh. Okay.
But I think our chairperson, Susan Loveland, would have an opinion, and I want to hear what she has to say as well.
Sure. Would that be something that you might consider a special emergency meeting by the library board?
Sounds good.
Okay.
Keep us up to date on that. Okay, let's move forward. Anyone want to make a motion here? What they'd like to do?
I move that we support the Director of Libraries request to the town administrator and the select board regarding any revision of services available to the public in our libraries due to increased concerns because of the amount of community spread at present.
Second.
Is there a second to that motion? Come on, somebody go for it.
Eric did.
Just raise your hand. So not everyone, great. Okay. Any other discussion on it? So, okay, see, there's none. So all in favor of the motion, raise your hand and say aye.
Aye.
Aye. Everybody there? Mary, you're on board? Probably. Okay, fine. So that passes. Okay, so keep us up to date on what, how do you want to move forward? Some of the specifics about whether it's closing, curbside pickup and so on. And we're seeing double-digit numbers of positive, people in town. So things are worsening. So, okay.
Thank you very much for your time and attention.
Okay, thanks for coming in.
My pleasure. Have a good evening.
You too.
Jane.
Director Murphy, where are we on updates here? What are we up to? We have a contact tracing, I see, there's town meeting, we got a number of things here. Maybe we could bring the agenda back up, would that help? I think the town meeting looks like I think it's next under updates, Bruce.
Right. It kind of got lost in the stats.
Muted, that's part of the problem, I think.
Yeah, here we go, Mr. Chairman. This is the COVID plan that was prepared for town meeting, which was very similar to the Springtown meeting. So this was presented to us. I had worked with the person putting it together to go over their protocols for that. For this town meeting, they did have the people go in, walk around to the side, social distance on the way in, mask were required. Then they checked off and then were escorted or directed towards their seating, which was also spaced off 6-foot spacing, and rows were also taped off for people when it couldn't sit there. I had worked with the police chief, just letting the officers at town meeting know if there was any questions on somebody that wanted to come in without wearing a mask, that, they would be available for assistance. So we did get a social distancing, our control plan to the office. That didn't come soon enough for the full board to review it, but I was able to take a look at it. So I think we can scroll through a couple pages just so you can see what was there. 2 pages of that, and then it goes into a written detail that the board has. Go ahead, you can scroll through. Let me go down a little bit more. The special town meeting of November 17th that was put together to discuss parking and the building entrances, registration, seating plan, participation, the 4 microphones, and they were wiped down between speakers. Elected officials on stage, there would be tables for them. Water and restrooms availability, signage. So they did put this plan together. I think another page here. I think that's the last page. Let's see. Is there anything? Yep, one more page. Okay. So they did have a plan put together, Mr. Chairman and board members. I think there was just under 100 people at town meeting. And it, I think it only lasted about 53 minutes, 55 minutes. So they did not go through all the warrant articles. They waived the last 7 through 15. One of them was the plastic water bottle ban. So that will probably be coming up back at the spring town meeting.
Bruce?
Yes.
Okay.
Any questions on that before, and if not, I can move on to an update on the contact tracing.
Yeah, why don't we move ahead?
Okay. There's no, I'll just, yeah. Can you just go back and show the coronavirus? That goes all the way back. You have to go scroll all the way back to get that photo. Bet we can't just zoom to that. I just wanted to show the coronavirus right there. For the contact tracing is for the positive cases that come into us through the state Maven system, is we work daily with the visiting nurse and the state contact traces collaborative. Which that means is as a positive case comes in, it automatically goes to the VNA, and then they will call the positive person, ask them the general question. I don't think I included all them. Name, address, who's in the household, where do they work, where have they been in the last number of days. I think the difficult part, and I think the really the glitch and the weak point of the whole thing is the positive tests aren't received for maybe 3-4 days after the person has tested. So a person could feel ill for 1 or 2 days, not quite sure if they have the coronavirus yet, then decide to go get a test, and hopefully they get a test within 1 day, or sometimes have to make an appointment, which could be 2 days. So they're already 4 days in, and then they don't get the results for 2 days. That could be 5 to 6 days before they know they're positive and informed that they have to quarantine, self-quarantine. And then they would get a call probably at that time from the VNA or the state tracers explaining quarantine procedures and finding out other people that might be associated with them, such as household contacts or other close contacts who would also have to go self-quarantine. So I think that's the little glitch in this whole thing. The weak spot is it could be 4, 5, 6 days where they've already been out carrying the virus in the community. They do call them during their quarantine period to make sure people are quarantined, but I'm not really sure from all our checking that people are staying the full quarantine at home. Obviously, some people have to work. I mean, that's important. Especially once they start to feel better, they need to, work to, let's say, get the food and pay the bills. So you just don't know where they are when you're calling them. Are they under quarantine? When the case comes to us, we look at it in the office. Phil, who's been our coronavirus staff person, that's spending probably at least 60% of his day on it and checking it at nights and over the weekend. Is it a true Yarmouth case? We've had some come in that weren't Yarmouth residents, was the wrong town. So we've had to move that off to make sure we're only getting the positive cases in Yarmouth. The other thing Phil's looking for is it associated with a nursing home or an adult living facility? That way we can call them to let them know, to make sure they received it in time. If it appears to be a school-age child, we will call the school nurse to see if that person's in school, and the school nurse will be able, the lead nurse will be able to see if the person has been out sick for a few days. And if the person's been in, we'll start the procedures of looking at the seating in the classroom and the buses seating. If we find that the person was in school, then we would have to do, in conjunction with the contact tracers, working with the school to, or a business to remove some people that were close contacts. So it's a continually process that we try to stay in touch with, and that's at night. Phil will keep an eye on it at nights, and then on the weekends that we will also, Phil will also keep an eye on it to see how many cases are coming in and whether the school nurse needs to be contacted or a nursing home. Sometimes we'll get a call from a resident, a parent of a school-age person, or somebody that wasn't just feeling well, and tell us they just got a test and came back positive. And they were informed by a call from the doctor, and they're just letting us know as a heads up because it hasn't come through the state system. So some of those cases, we're able to get a couple-day jump notice on it. So I just want the contact tracing, sounds great, but it's not reaching out all the people and all the contacts that person might be in. And sometimes it's several days late. So I just wanted to, I know we've talked a couple times, Mr. Chairman, about that. And that's the weak spot we hear on the Department of Public Health calls. The other part is, go ahead.
I was going to say, as well as the people that will not respond to the contact tracers.
Yes, and we're also finding quite a bit of that people aren't responding to some of the questions or some of the calls. That makes it difficult. We do have an interpreter that we use for the last cluster that we had between Yarmouth and Barnstable that we worked together on. So we did bring an interpreter and put some languages up on our website for that.
Good. Bruce, I have a question. How do you decide someone has recovered? How do they get put into that column?
So at the very end, the contact tracers will call the person back. It's usually within the 14-day period. At the end of 14 days, we'll call them back and ask them when they had their last symptoms. If they have recovered from all their symptoms and don't have any symptoms, that contact tracer would issue them clearance. And sometimes that's by a written letter.
And let you know.
Yes, it goes into the state
Database.
as completed.
Okay, thank
That'd
you.
be asymptomatic without medication. In other words, you need to be afebrile without taking Tylenol.
Correct.
If anyone knows someone who's looking for work, the state is hiring contact tracers. It's about a week-long training program. So they need people.
Yes, they had quite a few at the beginning of the pandemic and, you know, March, April, May. And then when it slowed off in the summer, they let some people go. So now that it's surging back on a heavy increase, they're in the process of hiring back. I think part of the concern with the tracing is the VNA doesn't do any tracing on weekends, so they don't pick it up to Monday. If we have cases that come in Friday night or Saturday, Phil can automatically switch them over to the contact traces that are still working. So it's a lot to keep track of it. When we do get the positive cases each day, Phil makes up a list during the day and at the end of the day and sends it just the address to police and fire. So when they're responding, they'll know of a particular location, not a name, but just a particular location. So that's another routine that the health department is doing daily. And that's 7 days a week. Okay, Mr. Chairman?
Next item on the agenda was the COVID-19 funding request.
Yes. I wish we could jump around better.
This was a letter to
Yeah.
Baker, Speaker DeLeo, and I guess the Senate President.
Yeah.
Uh,
Yes, this was a letter that came to us regarding additional funding the state legislature's working at. We did get a request for support of that funding. And the chairman wrote a letter on behalf of the board. The town administrator wrote a letter on behalf of the town. And then I wrote one as director of health to go forward the increased funding to the towns. That money could be used for various services, education. We're looking at maybe a second signboard, electronic signboard to keep the messages going about being safe, wearing masks and no gatherings. I can believe the town can also use it for some of their funding requests also. So that was taken care of last week also. Okay. As we move on in the agenda, Mr. Chairman, I think number 3 on the agenda was the update of the state COVID that I did cover when we went over the all the stats.
Right.
All right.
So that brings us to
Complaints.
updates on complaints. We're still getting a few complaints of people not wearing masks. It's considerably less the last couple weeks. And some of them we're not getting people forwarding complaints, as we heard from the library that they're still getting them from time to time, people going into the library without wearing them. But I think in general, people are wearing masks more so is the issue of not wearing them all the way up appropriately over the nose. So that is getting better. Again, social distancing we've gotten a few times and family gatherings. So we're still getting a few complaints, not as much as before, but I just wanted to keep that out there so we could discuss it to the people listening and to the public.
Well, just, once again, the order by the governor is need to wear a mask anytime in public. And that's whether you're inside or outside. And also, if you can keep 6 feet away from someone, that doesn't make any difference. You still need to be wearing a mask. So, and that I think went into effect the first week in November,
Correct,
November 6th.
correct. Okay, thank you, Mr. Chairman. Still on the updates, if you want to give anything about Thanksgiving coming up?
Well, what's happening in town, obviously, and the rest of the country, the numbers are spiking. And for Thanksgiving, you could not think of a worse holiday. you know, the way most of us celebrate. It's having people getting together, often with people who don't live in our home. So you're near each other, you're indoors. Masks are often, probably will be off, unfortunately. People need to eat. People visiting from out of state. We have an older population in town, so you're going to be having people coming, kids from college and so on. It's a setup for transmission of the virus. And I can't think of a worse holiday, unfortunately. It's a, you know, it's a holiday we all love, and it means maybe making some sacrifices this year and doing it differently. But it's be difficult. I just expect in 2 weeks or so, the numbers are going to even increase the rate because of the holiday. And of course, we have more holidays coming up. You know, I think a lot of the responsibility is sitting with us as a board, the health department, the Board of Health. And my feeling is we need to act on it in some way, and starting now. I think that the town, things have changed in town a little bit. And I mean that in that I know the COVID-19 response team for the town. Bruce goes to represent the health department, I do for our board. And that team has not met in at least 6 weeks. It's not met. You know, I welcome the support of the select board. I'm not sure what kind of support we'll get. I think I see it as the board is kind of split in some ways, in the sense of supporting us or not. It's, you know, the selectmen took a vote of whether to support or not support the governor's orders, and you know, it was a split vote. But it was in favor of not enforcing the governor's orders here in town in dealing with COVID-19. It was disturbing to me watching the town meeting. We had one member of the board not wearing a mask, and we had one that was just covering their mouth and not their nose. And that's quite a statement. It's a model for the community. So I think it's really our board that needs to be proactive and see if we can really do our best to protect the health of the residents here. Board members, any comments?
What kinds of actions did you have in mind, Hillary?
Well, I think the library was a good example.
Mhm.
And that's a start. I think the hours in town hall need to be looked at. You know, do we need to go back to, you know, having people mainly working remotely, restricting the number of hours that people can come into the building? And those are complex issues, but I don't see anything happening right now yet. And I think we're falling behind. So it may be trying to in some way getting the meetings going again. We had a representative from every department in town meeting. In the beginning it was every single day, and then it became once a week, and now it doesn't exist. Do you see, you know, does DPW, as an example, do they need to make some changes there or not? I'm just giving an example to protect the, you know, people working in our town.
So what would you like of us? What can we do to help with this?
I think a discussion would be a good place to start, to see, looking for thoughts. There are 5 of us. I'm just one of 5 people on board.
We know where this is going, right? I mean, we can look at the graphs and we see where it's going, and we don't expect it to get any better with the coming holidays. So
Right.
I share the feeling that, you know, there needs to be some action. So I'm happy to help how I can, you know, whether it's just support, but
I think a place to start would be education, for sure. That's an easy one, and, you know, it usually entails spending money. I know Bruce and I have spoken about this, getting to know the board and getting messages out, you know, in key spots on the roads in town. But it may need to be more than that.
Mr. Chairman,
Yeah.
this is Mark Forrest.
Oh, great. I
Hey,
didn't realize you're on. Good.
yeah, I've been following the meeting tonight, and I just wanted to jump on and let you know. Yeah, I think there's a growing awareness and a concern, at least that I'm picking up. You know, one of the reasons why at town meeting we decided to shorten the town meeting was because the number of calls and the number of people expressing concern about the rise in cases. It was recommended that we shorten the meeting, and we did. And we worked out an arrangement with a number of the petitioners, and everybody was cooperative. So I know sometimes you feel alone in this whole enterprise, and sometimes it can be controversial, but you're not alone right now. There are a lot of people very, very concerned about what's happening. And I know the select board has been paying closer attention. And at the special town meeting, everyone on our board wore a mask, just in case there's some question about who is wearing a mask. The other thing that I just want to say is that I've been chairman since back in June, and I've had an opportunity, just as in my capacity as chairman of the board, to work more closely with Bruce. And I've been incredibly impressed with the service and the work that Bruce has provided the town, and also to the board. He's attended a lot of our meetings. He's been keeping us up to speed on things that are going on. The drive-in site, he sort of worked above and beyond the call. And so I think communication's improving. I think relations are improving. I'm here tonight because I'm very concerned about the numbers rising, and I'm very concerned about the health department's thoughts and recommendations, as well as the board's. So I just wanted to thank you for just giving me a moment so that I can just commend you and the health department for the outstanding service that you've provided the town. And I look forward specifically, and I know others do it, to any other recommendations that you might have, or some advice and guidance, you know, going forward. So,
Mark, thanks for checking in. Two things. One, it'd be helpful. One thing we all could use some assistance is maybe getting the weekly meetings back up and running for all the departments. Well, it's overdue. And I beg to differ on what took place at the town meeting. I was watching it, so we can discuss that at some point. That's
sure
what I observed.
Okay, well, I'll certainly take this back, and I'll talk to you separately on this other matter.
Great. Board members.
I think that it's a great step forward that Mark joined us tonight to express his support, or more willing to have more open communication. I think that's great.
I agree. Thank you again. If there's nothing else, we can just work our way down the agenda. It looks like number 5 is an update on the flu clinic. Director Murphy.
But could we go back for a minute?
Oh,
I
wait.
mean, I'm the kind of person that it takes time to process things. I think that it would be a good first step to get that meeting together and to hear from the departments, just like we heard from the library tonight, to kind of see how they're feeling, how their staff's feeling, what recommendations they might have for trying to minimize the opportunity for more community spread. And then hear about it as a board and support, or, you know, make some further recommendations or whatever. I think it's kind of difficult to do it when the governor is not stepping back, officially. But I also don't think that that should stop us from putting in our own stricter requirements or restrictions.
Yeah, the meetings we had, in town were great. Every town department had a rep on for every single meeting. It was really, they were very productive, and it sort of fell off. But I can speak with Mark and Bruce and see how to get this going again. We accomplished a lot of work at those meetings.
Okay.
Anyone else? I didn't mean to jump ahead. If there are other comments on the agenda, we can move along. Why don't we do that? Bruce.
So, yeah, back to number 5, we still have the flu clinics going on at the partnership with Cape Cod Hospital Healthcare Pharmacy. People can call there for an appointment. And I haven't talked to them in about a week, but I know they did have the high dose at that point in time, flu shots available. So
Are they being kept busy?
Pardon?
Are they being kept
I
busy?
haven't heard in the last couple of weeks, but I believe they probably have been steady. I'll give them a call to see how they're making out, but I think we would still recommend people, it's not too late to get a flu shot.
Absolutely not. Yep.
Any month, it's time to go. I mean,
Right.
this is the time. If you're waiting to January, then get it then. I mean, everyone should have it.
Yes. Okay, as we move along to sticker shock, let me call that up, and we have our Zoom master Meredith that will give an update. Besides running the meeting, she's going to make a presentation.
Okay, so this was something fun we got to do.
Everybody else?
It's called Sticker Shock.
I don't know where we're getting it. Is Charlie's on?
Yeah. So this is the 5th annual year we've participated.
Well, let me see. I don't know why. Oh, we're both getting feedback between both computers now. Both muted you. Can you mute everybody? Sometimes it can be just between the two computers. Go ahead. No? Why can you try now? Why can I hear my voice now muted?
Okay. So Sticker Shock is an awareness campaign.
Can you mute everybody? Where's my volume on this? I don't have a volume thing, do I? Okay. Sure. One last time, no?
Okay.
Not gonna work. For some reason, Mr. Chairman, all of a sudden, we're getting double feedback on the last item. And unmute him.
Okay.
You're fine, but I think because we're sitting so close together, the two computers are for some reason, we're getting feedback between the two laptops.
Is it still the same?
So even with me muted now, we're still getting feedback. You want to just try? Huh? Good. Fine. Does it?
Did you guys switch computers?
See if you sit there, does that help?
Okay. See if this helps. Can you hear me okay?
Am I muted?
Can everyone hear me?
Yep.
Yes.
So, Sticker Shock is an awareness campaign. The goal is to reduce underage drinking. This is the 5th year in a row that Yarmouth has participated. And we had all of our liquor stores in town participate, so all 9. In total, there was 8,000 bags. I reached out to all the liquor stores and let them know of it. A lot of the stores were already familiar from participating in the past. There's a couple new store owners, but everyone was equally as excited. And we picked up 8,000 bags, the brown beer and wine bags. And we partnered with the NHS, the National Honor Society students at DY High School. Their teacher, Allison Adams, she helped us organize, and we were able to stay after school last Monday and Tuesday to actually stick 8,000 stickers onto 8,000 bags. There was 2 groups who did it. They were all really excited. They had their own creative ways of laying the bags out and getting all the stickers on. Everyone had masks on. There was social distancing. We were in the library. And they got pizza from Peterson's after, so it was a win-win for everyone. So this is the press release, and at the bottom you can see the sticker. So once again, the objective is to remind people who are purchasing alcohol not to buy it for minors. The actual dates was Friday the 20th and Saturday the 21st, where all the liquor stores used those bags with the stickers on it. And they had some posters to hang up in the walls that we got from Gosnold. A few other communities participated, Bourne and Falmouth included. So it was really successful overall. We had more stickers than last year, another 1,000 extra this year. Luke's Liquors even doubled their amount of bags they gave to us. So everyone was doing a great job. All around, great teamwork with NHS kids.
Good work.
Meredith, thank you.
Thank you.
Well done.
Terrific program.
Yep.
Okay, switch chairs.
Well, I'm glad we could get that through, Mr. Chairman. Meredith's been with us about a year and a half now. Graduate of UMass Public Health, works in the housing program, and we're trying to pick her up full time. But she's been absolutely terrific, and I'm glad we got her in tonight, because the last year when she tried to give this, the camera were downstairs, channel 18 didn't work. So we're glad to get her. We're glad to get her on camera, even though she was masked up.
Good color.
Good. So with that, Mr. Chairman, that ends the presentation that we have for our agenda. I will continue to work with you on education over the next couple weeks to what we can get out to something over the holidays.
Okay, anyone else?
Well, and if we can meet again as soon as this group has gotten together and you have something to bring back to us to chew on.
Yes.
Okay. If we can make that happen. Okay, anyone else have anything? If not, someone can make a motion and we can adjourn.
I move that everyone have as good a Thanksgiving as they can and that we adjourn this meeting.
Second, someone?
I'll second that, Mary.
Thank you, Deborah. Okay, all in favor, just raise your hand and say aye.
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 Aye. Okay, meeting is adjourned. Stay safe, everyone.
Happy Thanksgiving,
Thank you.
everybody.
Thanksgiving.
Get everybody out.